we open it on?
You want to reopen 8? Can we reopen number 8, please? No, you voted.
Hall, Mitchell, Roth,
Nielsen, aye to no.
Nielsen, aye to no.
Actually, can you make Win I to know?
Win, aye to no.
We have, and we'll keep that call open.
4-1.
4-1.
I mean 4-2, I'm sorry.
Keep it on call. We have Assemblyman Bonta. Item number 15, AB 2216. Are you supporting? Is he supporting it? 15.
Thank you, Madam Chair and colleagues. I'm pleased to present AB 2216, which helps address California's primary care provider shortage by creating a new state fund to sustain California's current teaching health centers and to establish new teaching health center sites. THCs are accredited community-based primary care training programs committed to preparing primary care providers to serve underserved communities and in health shortage areas. And as you all know, we have a primary care shortage in California, and more than ever, we need to invest in our primary care infrastructure. This bill helps achieve that. California ranks 32nd in physician access, with California's ratio of primary care physicians participating in Medi-Cal dismally low at only half of the federal recommendation, and 6 out of 9 regions in California have a primary care provider shortage. But with THCs, 40% of graduates from THCs become primary care providers in nonprofit community health centers. So they stay and practice where they've trained, and that is as compared to just 4% who are trained as traditional medical residents. And we know that THCs also attract medical school graduates who are from the communities in which they serve and represent and reflect the cultural and linguistic diversity of the patients that they serve. And with me today in support, I have Megan Brightwell, representing the California Primary Care Association.
Do you know we have support on both sides?
Thank you, Madam Chair. Megan Brightwell on behalf of California Health Plus Advocates, which is the advocacy arm for the California Primary Care Association. I'll just make a couple of points. California Health Plus Advocates is dedicated to advancing the mission of community health centers through state and federal advocacy, representing more than 1,100 clinics in the state and caring for 1 in 7 Californians. California has been a leader in expanding access to healthcare for everyone, and healthcare centers are helping lead this charge. We're also leading the charge in new models for training our next generation of primary care providers. Thanks to the vision and leadership of the legislature and the governor, this year's budget, now headed to the governor's desk, confronts this workforce training need and primary care provider shortage through a significant investment in graduate medical education and retaining our and money dedicated specifically for our teaching health centers. AB 2216's provisions create a clear path to sustain and expand the teaching health center model in California, and for those reasons, we would ask for your support today. Thank you.
Thank you. Support?
Jennifer Simoes with the Medical Board of California in support.
Catherine Austin Scott, representing the California Academy of Physician Assistants in support.
Michelle Gibbons with the County Health Executives Association in support.
Sylvia Castillo with California Family Health Council in support.
Any opposition? Seeing and hearing none. Question?
And I just want to thank Senator Bonta for doing this bill. As a former residency director, I helped set up a rotation with a clinic where the pediatric residents did their continuity clinic. But I guess my other hat is I'm the author of the Financing Graduate Medical Education Policy Statement for the American Academy of Pediatrics. One of the biggest challenges we have is that funding for residency programs flow through hospitals, and certainly hospitals do help support outpatient training that's required through the accreditation body. But we also know from the literature that the cost to train residents is more expensive in outpatient settings like clinics than it is in hospitals. Also, the revenue that can be gained from the clinical service is actually greater in the inpatient than the outpatient setting. So there tends to be a drift toward keeping your residents in the hospital and not having them in outpatient settings. But yet, we're trying to address the primary care shortage and being sure they're well-trained for outpatient sites like our community health centers. So this is going to be very important in moving that forward. So while we've certainly, as a legislature, have made some gains that we have put in funds for Song Brown and so forth, we also need to be sure that we have incentives for training in outpatient sites and particularly in community health centers. So I really appreciate what you're doing with this bill. Thank you. And if it has been moved, I'll move it.
Thank you, Dr. Pan.
Any other questions? What's the pleasure of the committee? Move, thank you. Please call, this is due pass to appropriation. Please call roll.
Hernandez. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
5-0, we'll keep it on call for other members.
Thank you, Madam Chair, colleagues, and staff.
Next, I see Assemblyman McCarthy, item 9, AB 2017, and we have support on both sides.
Okay. Thank you, Madam Vice Chair and members. I'm pleased to present AB 2017, the College Mental Health Trust Act, dealing with mental health services at our college campuses, our community colleges, UCs, and CSUs. We know there's a tremendous need to address mental health issues for Californians. However, we've also noticed that college campuses many times don't have these services. We know that depression and anxiety is one of the top reasons why young people drop out of college. And also startling is that suicide is the second leading cause of death among college students. And with us, we have an innovative approach to amend Prop 63, the Mental Health Services Act, to provide a matching program for the state to administer, with colleges putting up half the money and the state through Prop 63 putting up the other half to expand mental health services. I ask for your aye vote. I have the Steinberg Institute to testify, as well as a local faculty member at community college.
Please start.
Good afternoon. My name is Anna Hasselblad with the Steinberg Institute, and we are proud co-sponsors of AB 2017. AB 2017 would sustain and build on investments made from the Mental Health Services Act Fund that we know works for California's public college students. It's important to note that of California's nearly 3 million public college students, at any given point, 750,000 of them are struggling with a mental illness, such as depression, anxiety, or the first signs of psychosis. AB 2017 seeks to prioritize this vulnerable student population who, along with faculty, administrators, and their families, are calling for improved access to mental health services. It is only right to respond to this need when we have a funding source so specifically dedicated to prevention and early intervention. AB 2017 would fund a statewide effort by using a small percentage of the Prop 63 revenue stream. The benefits of this time-limited investment would bear out in the long term for both the colleges that would better be able to meet the needs of mental health needs of their students, but also to that of counties who would directly benefit from students' improved linkages to services, ensuring they can access care before their mental health needs become more severe and costly. AB 2017 has the potential to make a difference in tens of thousands of lives and help set up a colleges and students alike for ongoing success. I thank you and respectfully ask for your aye vote.
Next, please.
Ladies and gentlemen of the Senate, it's an honor to be here today, and I thank you for your time. My name is Michael Peck. I'm 37 years old. I'm a student at American River College, and I suffer from PTSD and depression. Many students across this state suffer from some form of debilitating mental health issues. How we develop these problems is not important. What is important is where we can go for help as students. I self-medicated with drugs and alcohol for many years, which is why my focus of study is chemical dependency counseling, which goes hand in hand with this bill. It is imperative that students and staff have access to mental health services on campus, and that they be highly visible for students to see so they know where to go. It may be the only time students can access this kind of help. Not everyone has the money or kind of coverage to seek help. They may be ashamed, scared, hurting, and confused about what they are experiencing and feel that they can't go to close friends or family. This is absolutely my story. Many will simply leave school, harm themselves, or sadly, they'll take their own life because they don't know where to turn. This bill will help the ease of access to these services and help campuses hire more staff needed. Please, let's help those who cannot help themselves and pass AB 2017. Thank you.
Next.
Thank you. Please proceed.
Yes. Thank you, Senators, for your time this afternoon. I am Peg Scott. I'm here today representing the Faculty Association of California Community Colleges. I am a professor of psychology at American River College. I am also a mother of a dead son. My will took his life on June 30th, 2010, between summer intercessions. He had finished his first session successfully at Folsom Lake College, and a week later was to start his prerequisites for an EMT program at American River College. Instead, he took his life. I was later informed that the cause of Will's death was a self-inflicted gunshot wound to the head with a 12-gauge pump-action shotgun. Will was from a loving nuclear family with a large extended family to boot. His freshman year in high school, he was bullied. Even with the best medical and psychiatric help, he ended up spiraling down that dark abyss of depression and social phobia. He was homeschooled, graduated with honors, and was transitioning to the college experience. In the end, it was all too much. Each semester, I see many Wills in my classroom. Wills that come from dysfunctional homes and destructive environments, scared and scarred, mentally and physically ill, hungry and sleeping in cars, raped and robbed. When they decompose or just have a really bad day, our recourse at Los Rios Community College District is to dial 2221, and an armed, uniformed police officer will come to assist. Ethically, as a psychologist, I cannot do that. Mental illness is not a crime. A student reaches out, they need help. They need help quickly, and then they need to be managed until the issues are resolved, or better yet, they have developed strategies to deal with them. I am not alone. There are many more Wills out there. As a very sad and heartbreaking example, last semester, 3 American River College students took their lives. We lost 3 students to suicide. Let there be resources for our students, please, and let those resources be immediately available on campus in a professional, warm, and welcoming environment. I thank you so for your time this afternoon, and I hope and request your aye vote.
Thank you. Anyone else in support?
Mr. Chair, members, Kimberly Chen on behalf of the California Pan-Ethnic Health Network in support.
Lori Jones, Director of Legislative Affairs of the Associated Student Body Student Senate, American River College. We passed a resolution in support, so we vehemently urge an aye vote.
Hi, I'm Melanie Martinez, and I suffer from mental health issues, and I just graduated from American River College, and I support this bill, and I'm going to CSUS.
Hi, my name is Susan Howe. I'm a professor of English at American River College. In memory of student Adam Wood and all of my students in need, I support this bill.
My name is Devin Parker, student at ARC, veteran, U.S. Navy, suffer of PTSD, and I wholeheartedly wish that you would pass this measure.
Deodonis Moquette, student at ARC, I support.
Gersten Leahud from the Student Senate from California Community Colleges in strong support of this bill.
Cynthia Marks, nursing student at American River College, mother of 2 college students, and vice president of Life is Worth the Walk, And I'm here in memory of Will Scott Durango. And I'm strongly urged for your yes on this bill.
My name is Fatima Sidhu. I am a student at American River College, and I'm here for support on this bill.
Les Shepard, representing the American Association for Marriage and Family Therapy and Support.
Hello, Jesse Foster for the California Community College Association of Student Trustees, and I urge your support on this bill.
David Hilton, American River College Student Senate President, and I was previously institutionalized with depression, and I urge you guys to support this because I understand how powerful this would be.
Good afternoon, Kevin Sabo on behalf of the UC Student Association and the UC students who are no longer with us today. Proud co-sponsors and urger I vote for this bill. Thank you.
Megan Brightwell on behalf of the California Federation of Teachers and Support.
Good afternoon, I'm Faro Diaz on behalf of the Cal State Student Association, representing the nearly 500,000 CSU students, proud to co-sponsor and in support. Thank you.
Rebecca Gonzalez, National Association of Social Workers, California, in support.
Jasmine Gordon with the California Black Health Network in support.
Troy Myers, English professor at Sacramento City College, local academic senate president, speaking in strong support. The statewide academic senate passed a resolution by acclamation in support of this bill. And as someone who suffered with obsessive compulsive disorder since childhood and did not get treatment until I was in my mid-30s and my first 10-year job, I urge you to support this bill. Thank you.
Good afternoon, Chris Jansen, counseling faculty, Sacramento City College, in strong support of this bill, certainly in favor for our students.
Annette Barfield, LRCFT faculty president at Sacramento City College, and a counselor, and I ask you to please vote for this bill.
Good afternoon, my name is Luis Menace with the Student Center for California Community College Region 2, and also with the students of Sacramento City College, and we strongly support this bill.
Alex Galeana here on behalf of the Student Senate for the California Community Colleges, which represents up to 2.3 million students across the state in very strong support. Thank you.
Ryan McElhaney with the Community College League of California, representing California's 72 community college districts in support.
My name is Lisa Arnold Fernandez. I'm in strong support. My brother, Derek Ian Arnold, shot himself in my mother's basement, Dr. Barbara Arnold, in 1998. He had bounced in and out of our city colleges. He was 21 years old when he shot himself. He had sent me letters when I was 15 years old, when he was 18, when he was in Virginia, because he went away also to college in Virginia, and about how he wanted to drown himself and how he was really sad and depressed. And when he was brought back home, he bounced in and out of our city colleges here, and then he eventually shot himself. So I'm in strong support of finding mental health in our community colleges and in our colleges here where we really need it, and also with the school shootings that we're seeing. You look at UCLA, you look at Santa Barbara, and we're seeing shootings here, even at Sac City. We need help. And as a mother of young children, I sought mental help, and I pay $100 an hour every 2 weeks to get mental help. So if you're asking a college student to try and get mental help for $100 an hour, it's not going to happen. So we need your support. Thank you.
Thank you. Opposition? Opposition?
Hello, Dorinda Wiseman with the California Mental Health Planning Council. We agree with the concept. We have some grave concerns with the siphoning off of the MHSA funds, so we will provide writing to Senator McCarthy.
Thank you. Questions, comments from any of the members? Seeing no questions or comments, we have a motion by Senator Pan, and would you like to close?
Thank you. Just ask for your consideration. I would note there are many worthy programs, but this would take roughly 2% of the $2 billion and growing off the top of Prop 63. So I think it warrants our consideration. Thank you.
Thank you. Item number 9, AB 2017, due pass to Education Committee. Call the members.
Hernandez?
Aye.
Hernandez, aye. Nguyen? Nguyen, aye. Hall? Hall, I. Mitchell. Monning. Monning, I. Nielsen. Nielsen, I. Pan. Pan, I. Roth. Wolk.
That currently has 6-0. We'll place that bill on call. Enough to get out, though. And we'll now move on to item number 18, 2394, Medi-Cal, non-Medi-Cal transportation. Good afternoon, Assembly member, welcome.
Yeah, we've got. Okay, good afternoon. Mr. Chair and members, AB 2394 is a bill in reference to many Medi-Cal beneficiaries that report difficulty accessing health care providers, specifically specialists, due to the lack of adequate transportation. This bill is important for many families of low-income circumstances. This would address the issue in rural areas of California, and there was a bill that was similar to this bill that was presented last year, passed unanimously with bipartisan support. We respectfully ask for your aye vote.
Thank you. Anyone in support?
Good afternoon, Chair, members. Linda Way with Western Center on Law and Poverty, proud sponsors of this important measure. Many rural consumers report difficulty accessing medical services due to lack of adequate transportation. AB 2394 helps these consumers access medical transportation, thereby reducing the need for costlier emergency services. Specifically, this bill clarifies that non-medical transportation, that is, transportation to and from doctor appointments, are a covered Medi-Cal benefit. I'm here to answer any technical questions, but with me is Liza Thantranon with Legal Services of Northern California to highlight how this bill would help the rural consumers that she represents.
Thank you.
Good afternoon, Mr. Chair and Senators. My name is Liza Thantranon, Managing Attorney with Legal Services of Northern California. We provide direct legal assistance to health consumers in 32 Northern California counties, many of which are very rural. It's not surprising that accessing specialty care can be very difficult in a rural area. There are simply fewer providers. However, since the expansion of Medi-Cal managed care into California's rural counties, we've seen a persistent problem with people being able to access specialty care because they're being sent farther away. For a low-income beneficiary getting to a specialist who is far away, it's often very challenging because public transportation is not available. They don't own a car and/or they can't afford the trip. I frequently see clients who miss appointments or choose to forego care because they can't find a way to get there, or they have to go without other necessities instead. I had one client who lived in El Dorado County and urgently needed to see a urologist for multiple visits. Her Medi-Cal plan sent her to a specialist who was 166 miles round trip from her home. She was lucky in that she had a car and she could drive herself, but in order to afford the gas, she had to stop paying her utility bills and subsequently had her electricity shut off. We had another client from Mendocino County with a neurodegenerative condition which caused widespread nerve damage in his body, including in his skin. He was sent to a dermatologist in San Francisco, which is a 240-mile round trip from his home. Because of medications he's on, he cannot safely operate a vehicle, and the only public transportation option to San Francisco would take 3 buses, 6 hours one way, and at least 1 overnight stay. His only realistic option is to pay out of pocket or pay out of pocket for a driver to take him, which is a significant financial burden and is not always feasible. These cases are not anomalies, but representative of the cases we've seen with people having difficulty getting access to specialty care. Clarifying that non-medical transportation is a Medi-Cal benefit would give rural residents meaningful access to health care. Thank you.
Anyone else in support?
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Thank you.
Brenda Diaz with California Coverage and Health Initiatives in support, as well as the Children's Defense Fund and the Children's Partnership.
Tam Law with Health Access in support.
Rebecca Gonzalez, National Association of Social Workers, California in support.
Michelle Gibbons with the County Health Executives Association in support.
Good afternoon, Mr. Chair and members. Bill Barnaby on behalf of the California Medical Transportation Association. We support the effort to provide additional transportation, particularly in the rural areas where it's really needed. However, we'd like to point out that the real effective control of medical transportation in Medi-Cal is the unregulated brokers. And they are not subject to any regulation. They subcontract with health plans. Their subcontracts are not public documents. So it's impossible to tell what they're doing. So until something is done about these transportation brokers and some sunshine is shined on them so that we can know with a little transparency what they're doing and what their criteria are, Medi-Cal transportation is going to remain problematic. Thank you.
Thank you. Opposition?
Chair and members, Kathy Mossberg, representing the Local Health Plans of California. And we want to thank the author's office and sponsors for working with us, taking some technical amendments to clarify some portions of the bill. We do have one. We have currently an opposed unless amended position. We have currently one amendment we are requesting, a 6-month delay in implementation. And in the case of this, what we want to make sure to do is have adequate amount of time to put together networks. We think this is a very valuable service. We do want to provide it and certainly provide it as broadly as this bill it wants it to be provided, but we do need to have time to get this into our rates as well as to build up an adequate network. So we have requested of the sponsors and the author's office to please continue conversations with us and looking at potentially taking just a 6-month delay. Thank you.
Jennifer Alley with the California Association of Health Plans. We've been working very closely with LHPC and the author and sponsor of this bill, and we do appreciate the work that's occurred so far. But with the January 1st implementation date, it's right in the middle of our rate year for it would be right in the middle of our rate year for 2016-17, and my members would be responsible to develop a network to ensure that transportation is available to their enrollees. However, they will not know what the reimbursement rate for that would be, and it makes it difficult to establish appropriate contracts and reimbursement levels for the providers that would be giving transportation to the enrollees, and we'll hopefully continue our discussions with the author and sponsor. Thank you.
Thank you. Anyone else in opposition?
Yeah, John Winger on behalf of Anthem Blue Cross. We would echo the comments of LHPC and CAP, also support the 6-month delay.
Senator Nguyen?
Thank you. I'm supportive of this, but I want to see if there's any way would you be open to allowing a phase-in period so that the capitation rates and the networks can work together, given that we're kind of in the middle and on to next year as well. And with it, I mean, the benefit's a good benefit. It's needed. I supported your bill last year as well. We also talked about the mileage as well last year on the other bill. I just want to make sure, though, we're not causing other problems because it's not part of the benefits right now.
Well, I'll say that, there are a number of plans already that provide the non-medical transportation both to adults and children. So it isn't something new, right? The question of reimbursement rates, we've also gotten confirmation that they will be reimbursed. In terms of the lack of clarity on how much, certainly would work with the opposition to try to get to the core of, what that reimbursement will look like. But, these are issues that this same bill came before this committee last year, and none of those issues were brought up. In fact, there was much consensus on the way the bill was written. I think someone asked, so why are you bringing this bill back? And beyond the question that you've asked, we believe that the MCO conversation this may have been an innocent bystander victim to those conversations, and which is why we've brought this bill back forward.
If I understand, it's currently not part of Medi-Cal rates within the capitations, so that's why the phase-in would help. If I'm wrong, please correct me. Can you?
My Medi-Cal members report that they do provide non-emergency, non-medical transportation in very limited instances, and that is not included in their reimbursement rate. This bill creates a new Medi-Cal managed care mandate in which our read on the bill is that all enrollees that needed access to transportation, we would be obligated to provide it. And so that is a very different than what the current policy is. An example of the limitation on a plan that may choose to provide transportation would be to a Medi-Cal beneficiary, perhaps on dialysis, where it's critical that they get to that appointment. And so the plan does cover that, but it's not included in their reimbursement rates right now, and so it's a cost that they eat. And so when you create a benefit in the middle of the rate year, then the plan would be be responsible to implement the benefit and absorb all of those costs until it could be included in their rate. And that's very difficult for some of our small local county plans to be able to incur those ongoing costs until they're added to the rate.
Is that accurate, Mr. Semmelman, or?
If I could just clarify, for children, it is in the reimbursement rate, it is a clear EPSDT benefit. For adults, it is not in the contracts, and so plans do optionally provide this benefit. And in some of the conversation that we have had with the plans, that some have reported bill it as a cost savings. And in the bill analysis last year, we did find that a good amount of plans did provide it. I think the range was 50 to 70%, although, as mentioned, there are utilization controls. It is more restricted than the bill now. And so, but it is, for the most part, all plans do provide it for children, and so there is a known cost there, and they are being reimbursed for that.
So what I'm hearing and what my understanding, just making sure that I understand both of you, is that all children right now are part of the program. The adults, though, are now being given the non-emergency by the plan on their own cost. It's not part of the capitation rates. So if we move forward, they would have to observe it immediately versus waiting, because since we are in the middle. As Assemblyman, would it be possible to consider phasing it in? It's a good program, and it sounds like the health plans are not opposed to it. I think it's the implementation and also knowing what their costs will be, and that has to be part of the capitation rates that the Medi-Cal would have to also look at as well, because we are in the middle of it.
Something that we're willing to consider. What we don't want to do is delay, the actual implementation and making this accessible to the thousands of people who are Medi-Cal recipients. And for example, in my district, where in order to access, specialty type care, it could be anywhere between 4 and 6 hours round trip to get to and from these services. And whether it's phased in or there was a mentioning of a 6-month delay, I think that it's really doing a disservice to those who are having a hard time accessing specialty type of medical services. So we're open to considering what that phase-in looks like, but I'd hate to further delay for people to access very critical services in our communities.
Yeah, no, I mean, I'm not in a disagreement. I think we need this. Like I said, I supported last year, and I'm supporting this year. I just don't want, while you're in the middle of the budgetary for the capitation, et cetera, the local plans, that if we don't phase it in, it's going to hurt other services. Because, as you know, capitation itself, you get X amount of money for the month per patient, per member per month, PMPM. That could then divert the funds from other care to this, which is necessary. They're all necessary. It's just a matter of figuring it out. And all companies, including local health plans that are, the coast plans, do look at it at large in terms of their budget. And so if we add this in the middle and it's just 6 months, I think it would be extremely helpful. So if you would consider, I would appreciate it.
We would definitely make a commitment to engaging into those discussions.
Thank you.
Any other comments? We have a motion by Senator Monning. It looks like there's a commitment from the author to entertain some dialogue, so I'm assuming you would have that discussion in appropriations. Is that correct? And would you like to close?
Respectfully ask for your aye vote.
Okay, item number 18, AB 2394, due pass to appropriations. Call the members.
Hernandez?
Aye.
Hernandez, aye. Nguyen? Nguyen, aye. Hall? Mitchell? Mitchell, aye. Monning?
Aye.
Monning, aye. Nielsen? Nielsen, aye. Pan? Pan, aye. Roth? Wolk? Hall, aye.
Currently at 7, we'll place that bill on call.
Thank you.
And we are now at item number 192589, Gomez, Public Health Lactation Services and Equipment.